Swadika, welcome to Thailand Today here on NBT World. Departments of Health to share information on how to end the transmission of HIV and syphilis from mother to child. On February 28, 2019, Dr. Pranpimon Vipulakon, Director General of the Departments of Health, Ministry of Public Health, has revealed, following a press conference on cooperation to eliminate the transmission of HIV and syphilis from mothers to their children. Thailand is the first country in Asia and the second in the world where the rate of HIV transmission from pregnant mothers to their newborns has fallen below 2%. The World Health Organization (WHO) global guidance considers mother-to-child transmission of HIV to be effectively eliminated when the rate of transmission falls below 2%. She said in 2018, only 1.68% was found, and Thailand can maintain the quality of the operation to date. It was certified by the Global Validation Advisory Committee in Geneva, Switzerland in June. Dr. Pranpimon added that Thailand will be able to end the transmission of HIV and syphilis from mother to child by 2030 and to reduce it to less than 1% by 2020. Earlier, Thomas Davin, UNICEF representative for Thailand, said this remarkable achievement demonstrates Thailand's extraordinary commitment and leadership in responding to the global pandemic. He said Thailand has set an example that will inspire many other Asian countries in their efforts towards an AIDS and syphilis-free generation. Department of Medical Sciences prepares to control quality of kit syphilis rapid test. Dr. Opad Kankawinpong, Director General of Department of Medical Sciences, said the department has prepared its readiness of laboratory facilities to control the quality of syphilis TB rapid test kit. He said the move is aimed to support the Ministry of Public Health plan to end the transmission of HIV and syphilis from mother to child by 2030. Syphilis is a systematic disease that has been divided into stages based on clinical findings, helping to guide treatment and follow-up. Persons who have syphilis might seek treatment for signs or symptoms of primary syphilis infection, secondary syphilis, or tertiary syphilis. Latent syphilis can infect the central nervous system and result in neurosyphilis, which can occur at any stage of syphilis. Early neurologic clinical nerve dysfunction, meningitis, stroke, acute altered mental status, and auditory or ophthalmic abnormalities are usually presented within the first few months or years of infection. Late neurologic manifestations occur 10 to 30 years after infection. Rapid tests for syphilis are now commercially available. These are simple point-of-care tests and can be performed outside a laboratory setting with minimal training and no equipment, using a small amount of whole blood collected by a finger prick. Hence, they can address the problems associated with lack of access to a laboratory and the low patient return rates. Syphilis is again on the rise in Thailand, warning teenagers to avoid risky sexual behavior. Dr. Suwanchai Watana Yingjaranchai, Director General, Department of Disease Control, said the department has paid attention on Facebook page Hospital State reporting that syphilis on the rise in Thailand again. The Bangkok STD Center, which is under the Disease Control Department, recently warned on its Facebook page that the number of syphilis cases had been rising at a worrying stage. According to Hospital State, syphilis was found in both genders and in people of all ages. It is found in newborns because their mothers get infected and are not aware of their infection. In the first and the second phases of syphilis, symptoms could disappear without any treatment, but the symptoms can be serious when the disease reaches its third phase. The administrator of hospital staff said the biggest group of patients suffering from sexually transmitted diseases are teenage students at high schools and universities. Not long after the center raised the alarm, it was reported that a girl under 15 years of age had contracted syphilis while being pregnant with pertussis. Her partner is also younger than 15. A second Facebook page, Hospital Stailed, complained that the one possible cause is that people in Thai society might have lowered their guard in recent years amid a climate of lower fears over AIDS and HIV. The page is strongly advising people to avoid risky sexual behavior in particular. It said condoms were an essential part of safe sex. It emphasized that syphilis could be cured, but only if the infection wasn't detected and treatment given in good time. In addition, the page advised couples to undergo checks for sexually transmitted disease before getting married or having a baby. The Bangrak STD Center under the Disease Control Department has recently warned of its Facebook page that the number of syphilis cases had been rising at a worrying stage, with the biggest group of patients suffering from sexually transmitted diseases are teenage students at high schools and universities. Next break, we will talk with the head of the sexually transmitted infections cluster from Bangrak Hospital about why syphilis is again on the rise in Thailand. Coming back after a short break.
NBT World, an English language television channel in Thailand. Authoritative sources for all government information.
High standard content that's reliable and accurate across every platform. Our mission is to reflect the vision of Thailand.
Keep up to date through our application or website by searching for NBT World. NBT World, a vision of Thailand.
Welcome back to Thailand Today here on NBT World. Today we have a special guest, Dr. Rossaporn Kittiyaowamarn. She's the head of the Sexually Transmitted Infections Cluster, Bangrak Hospital, Department of Disease Control under the Ministry of Public Health. She will tell us why syphilis is again on the rise in Thailand, as well as preventive measures to decrease the risk of contracting syphilis. Swadika.
Swadika.
Well, welcome to Thailand Today program, Doctor.
Yeah.
Very young and energetic doctor. But you're facing with such a huge thing.
Yes.
Well, tell me, I was telling to the audience about disturbing news about coming back of syphilis.
Yes.
Why so, doctor? What happened actually?
Yes. If we see the information during the past 5 years, we have seen that there is a rising cases of syphilis. Yeah, you can see that since 2014 till last year, that is increasing. If we look at in detail, yes, you will see that the disease that have the highest of risings is syphilis. Yes. Compared to others.
Oh, we have syphilis, we have gonorrhea,
Yes, non-gonococcal urethritis, chancroid, yes, and venereum.
Okay. So is that mean that the syphilis is the easiest to contact?
No, those are the same. They can transmit via sexual contact, because they are sexually transmitted disease. Yes. But syphilis is different from other disease because of they need to go and have blood check. Yes,
to know that.
Yeah,
but
to know the result.
On the body, there's nothing appearing at all. That they can notice it.
Yeah, they can notice all, and also they can not see anything if they infected. Yeah, if No, I can say
They
that.
can eat well, sleep well.
Yeah, they can eat well,
Oh, really?
sleep well, many years.
Oh.
Yeah, many years. After they infected, some people will have chancre. I mean that sore. At yes, at the
Sore throat, sore lips.
yeah, sore lip or ulcer at the genital area. It
Oh.
depends on that where they have sex. I mean that if they have oral sex,
Oh,
they
they get
will
in the
have
mouth.
ulcer at the mouth. If they have genital sex, it will happen at the genitalia. If they have anal sex, this ulcer will occur at the anal area.
Okay.
Yes. So and this is painless.
Painless. This is
It
the
means-
trouble.
yes.
You can never know. You thought mosquito bite or something.
Yeah, maybe anything bite
Anything
or
bites,
maybe just
yeah.
a touch or yeah, right. So and then so they wait. So okay, maybe they don't want to go and see doctor, and then they wait at home and maybe go and buy some medicine and apply and wait and see, but it's gone.
Oh, really?
Yes,
It's gone into
even-
what? Gone in blood?
Yeah,
Is
they
it
go to the
blood?
blood.
Blood,
Yes,
blood.
go to the blood. So and then it become to be rash. Yeah, all over the body. Yeah, but not everyone will have
Rashes?
Yeah, rashes. Some people I forget to show. Yeah, if they have
Maybe
yeah.
you can show it to the camera. Yes.
yes this is a primary syphilis that after they're infected, some people will have ulcer at the genitalia or the ulcer at the mouth if they have oral sex. And after this appear, they will have rash over the body, especially on palm, yes, and soles. And some people can also have oral ulcer too.
ulcer too.
Yes. So those will bring people to the hospital and have blood check. But if people who have infected and unfortunately they have no symptom, and then they won't go to check, so they could not recognize that they have infected.
Oh.
Yeah, so they can transmit to other people.
So the other side, because the person who get what you call get this kind of syphilis,
Yes.
that means the opposite side. What do they themselves have it, right?
Yes.
So that this one get
Yes.
contacted.
Yes, maybe because in some people they have ulcer at the genitalia or inside the anal area. So the people, the opposite side who have intercourse with, they do not know that or recognize that their partner have infected or have ulcer or even abnormal blood test. No one can know. So they can get infected, can be infected from their partner. Yes, that's why I think that that I say that it's different from other diseases because they have to go and check for blood test. If they do not check, they could not know that they have been infected.
Can be suggestible that soon after you have intercourse with this, illegally or out of your home, you can have a test or something. All right. So, what is the current situation of this sexually transmitted disease
Yes, when
comparing to the past?
it's not bad like the past. I can say that before it means that maybe 40 years ago in Thailand we have more cases. You can see that since 1989, the rate of syphilis just go down. Yeah, right. Yeah, the rate of syphilis just go down, and it just come up during 5 years. So it's not bad like before, but it's like the thing that alarming us that the case is rising.
Definitely, it's alarming because it's something which is gone like smallpox. We thought it's gone. If once it come back, suppose it come back, it's a frightening situation of each country, especially Thailand. Supposed to be known that we have healthcare so well.
Yes.
So we don't expect this syphilis to come back at all.
We can, as I told you that because if they do not go and have blood check, no one know that they have been infected. That's why we have to alarm that anyone that if they have unprotected sex, they should go to have blood
Okay,
check.
supposing they protected,
Yes.
that the opposite also have, the lady have.
Yes.
and the gentleman visited him, visited her, so with the condom. To
Yes.
be safe.
I would say that even they use condom, it does not mean that they use condom only genital sex, but they have to use condom in any sex. I mean oral sex, genital sex, or anal sex, because I have seen some patients that I always use condom,
Okay.
100% use condom.
So
I check,
why do I get?
yeah, but why you have been infected? But when I ask that, when oral sex I do not use. When anal sex I do not use. Someone think that is safe sex. Yeah, it's the safe sex. So they do not use in oral area or anal area. Use just only genital area. That is the one reason. When anyone say that I use 100% condom, always use condom. So I will ask back that do you have oral sex? Do you use condom? Something like that.
There's a reason behind it, you see, because there are several ways to do it. So, what's the biggest group of patients suffering from this sexually transmitted disease, or why it is teenager students or increasing in this number? Why the young generation?
Yeah, if you see the syphilis rate, is increasing in all ages, but the highest rated is in the teenage during 15 to 24 years old, and we focus in this age. And when we go and survey, and we found that they have sexual intercourse early than before, like 13 to 15 years old. Yeah, they start to have sex together, and we also found that they do not use condom. Yeah, around 30% when they have first sex. Yeah, that is the one information that's why it's become to have more infected in this group.
That's why it will go for younger generation. If it is too elderly, they'll know how to protect themselves, right? And it may be thinking because they are 15, and their companion is also 13.
Yes.
They don't expect the 13 years to to be so much experience.
Yeah.
That much, you see.
Yes.
This is the trouble. So what is syphilis, and why is it so important?
Syphilis is important because of when
Actually, what kind of disease?
it's a bacteria.
It's a bacteria.
Yeah, it's a bacterial infection. So
Dirtiness.
no, dirty does not mean that you can get syphilis because of it transmit via contact. Yeah, I can say contact. It means that if you will have sore, not you, sorry, but
Right.
if anyone or a patient have ulcer at the genital area, it means that at the genital area has to contact, to the disease, right? So it means that anyone have to contact in that area. Mostly we are sexually
How many times,
transmitted.
doctor? Very frankly, we have to ask because this is unavoidable circumstance. We have to suppose if people to get contact. It's one time, two times, or more time, then only we get affected. Or
We could not say that how many times, but we can say that if the partner that they have sore, it means that have more bacteria on that sore can mostly can transmit easily. Yeah, and this is not disease that transmit just only sexual intercourse, but also transmit via mother to child.
this is beautiful. Really.
Yeah, when patient get pregnant and can transmit to
The
her
mother
baby.
has no knowledge.
I don't
What
think
is your experience? Tell us some experience of yours.
it's the same as other people because of if they do not check, they could not know that they have been infected. So it will transmit to her baby because of they do not check. The way that they will know, they will have to go to antenatal care, clinic. If they go and to antenatal care, they will have
But blood
blood
test.
blood test for syphilis 2 times. Yeah, during they get pregnant. Yeah,
Twice
for syphilis.
during the pregnancy.
Yes.
Ooh. So you need at least 2 times, twice, to check on that matter.
Yes,
Yeah?
that is the thing that prevent to get to pass syphilis to her baby. Yes, because we can treat in time.
Now can we line up this way? So once you can get contacted, sexually contacted, they will start after a few years.
Not
The latch.
like of 9 days to 90 days
Oh, 9
to
to
have
90
also.
So there are some
Yes.
some wounds in the mouth
Yes.
or rashes that you get.
All rash will get after that because it's secondary stage. After 30, after sore, and then we'll have three more months after sore to get rash.
And I believe that people say it. I don't know. Once you are treated and you're cured, but again in 10 or 30, it may come back in you. Is that so?
No, if they get killed and then if they come back, it means that you have infect again. Okay.
Repeated. I mean, you have to have the same behavior.
Yes.
Right? Not because
Yes.
it sprung up by itself. No.
Yes.
Oh, okay. And how about babies? Baby, what do they get? Or how do they get the symptom?
Baby can have the symptom at birth, or
Like
have,
a rash?
have birth defect or rash, or like abnormal breath, something like that, because it happened on diagnosed too. So it can detect at birth. Yeah. But some baby, if they do not have any symptom, maybe after that it will come. Yeah, after this. So the best thing is to have blood check. Yeah.
The blood check is like ordinary people. Nothing wrong to check that, right?
Yes.
So I mean, the person who go for that. Suppose we go for that, and so what? Nothing better than checking. But what to tell? If you go to the hospital and tell them that we want to check up the syphilis.
Yes, yeah. Anyone can go and to the hospital and check for. Yeah, I would like to like go to sexual health clinic, something like that. Yeah, to have check for.
Just simply check.
Yeah, just primitive to have for sexual health.
Is this syphilis is the starting of HIV?
It's not. It's because it comes in the same way. It is sexually transmitted disease. So if anyone can get syphilis, it means that they can get HIV also. Yeah, we have to check both usually because it's just blood check in one time.
So the risk factor is what? Risk factor is having
Unprotected sex.
unprotected sex only.
Yes, is the main.
This is the main cause.
Yes.
Avoid it.
Yeah.
You can never know about it. So how to test and diagnose to confirm syphilis?
When doctor diagnose syphilis, they use clinical diagnosis, also blood test together to make the stage of syphilis. Yes, because the stage of syphilis will tell that how many shot that patient will get after the diagnosis. Yes, so symptom and blood check together will tell the patient that is this syphilis or it's not. And
It all depends on doctor or the medical doctor who decide whether how many shots that you're supposed to.
Yes.
It depends on seriousness of the person.
it depends on how long that they have been infected. Yes, because if
Longer, the
Longer,
more
more
you get,
shots.
the more shots that you will get it. And we have sufficient, we have qualified medication for that.
yes, because after they get shots, we have long-term follow-up. Not like other diseases, we have to follow up every 3 months or 6 months, depend on the doctor. Yeah, to come and check. Yeah, that blood test it better or not.
Very interesting, really, and not only interesting but disturbing, really, because but it's not reach out of your reach, and for the medical personnel.
No.
You can cope with it.
Yes. Doctor, mostly they know how to take care of patient. Yes.
All right. So coming back to the end of the first part of interview. So next we will discuss on how to avoid being contracted syphilis. Please stay tuned.
In 2019, Thailand is ready for ASEAN chairmanship, working together and building solidarity to increase competitiveness and innovation with the people at the center. All sectors are ready to promote unity of the ASEAN community. NBT World is excited to be a full supporter of the Thai ASEAN chairmanship. Keep up to date on ASEAN 2019 movement with NBT World.
Welcome back to our program. We are still with Dr. Rossaporn Kittiyaowamarn. She will explain more about other syphilis related issues. Well, we've been talking a lot on this matter because it's concerned about Thai medication. Ministry of Public Health so much concerned about this, or is coping? Is it normal? It's nothing.
Yeah, we do concern about this. Yes, we other than we distribute and promote free condom in every government hospital to let everyone can reach condom. We also monitor, in pregnancy women that especially in teenage pregnancy or pregnant women that who come to antenatal care late. We do monitor that, try to let they get blood test early than other people, and treat in time. Yes. We also do contribute in outreach program. Yes, we go to in sexual enrichment and also in the place that risk group or maybe teenage or MSM area community that they go and have blood check. And we try to make a program to treat them in the same day. Yes.
One thing when we go for blood checking, we don't have to. We have to tell them specifically what to test, right? Or doctor will know.
Yes.
They know by themselves. Specifically.
If patients go to hospital, usually if they say that they have unprotected sex, usually
They have to report that.
yes.
Otherwise,
Yes. So if you go just symptom, I have rash, but you do not say anything. Maybe if doctor does not familiar with those rash, maybe you won't get any test. They won't get any test. Yes.
What I mean is because when we go to hospital these days, the hospital tend to suggest you to have blood tests, but that's diabetes,
Yes.
blood pressure or something. So we don't demand for it, but
Yes.
they are the one who offer it.
If you go to sexual health clinic, doctor will ask that from you.
Special.
Yes.
You have to go for
Yes,
special
for
one.
special clinic.
See,
Yeah.
like Bangkok,
Bangrak.
Bangrak
Bangrak
Hospital.
Hospital,
So
yes.
Bangrak is hospital is what? It's mainly on this matter.
Yes, is mainly
Tell us
on
about that.
sexually transmitted diseases and also skin disease.
Okay, wow, that's the only place.
Yes.
But this famous one, it seems to be like 100 years, almost 50,
more
60
than
years.
more than 50
But
years.
and it still
Yes.
remain. It's still located there. It's still there, and people still make use of it. Does it belong to Bangkok Metropolitan?
No, under
Yes,
this
under
Department
Ministry.
of Disease Control.
Oh, I see. So do you have branching like that, or just only that?
I can say that in Bangkok clinic that in the separate area they also have STD clinics too, but maybe they open only once a week or something like that. If anyone want to go and check, maybe they can call the nearest clinic.
Just now we did touch a little bit on the baby born, but how about the fetus? How severe of impact against the fetus if a mother contracted syphilis while being pregnant?
They can have a birth defect or
Can
stillbirth.
they go any medication to stop it while they're in the womb itself?
If already have defect, maybe medication cannot call the defect back like normally. But mostly they do not have any defect. Just infection. Just if they have only infection but no any defect, but antibiotic can help those child to be as normal.
Oh, really?
Yes.
So by giving antibiotic
Yes.
while the mother is pregnant?
Yes.
Oh, that is a little.
If
there is some
we
consolation.
treat since mother gets pregnant is the better way, the best way that to prevent maybe no transmit or pass the disease to those child.
I mean, she must have had it before.
Yes.
The mother
Yes.
have had before, and they already got into her.
Uh,
Not because in the meantime, during the pregnancy.
Can be during the pregnancy because we found that in the first blood check mother is fine, but the second blood check
Goodness.
mother has been positive for syphilis.
So how long for that period, doctor? That you
Uh,
can stop it. Then you can use the
4 weeks
antibiotic.
before 4 weeks before give a birth. Yeah,
Oh.
is the best way.
So antibiotic can be helpful.
Yes,
Oh, that is great. At least something.
yes, 4 weeks
can stop.
before labor.
And that can be cause of the blindness or
Not
I think for the
blind,
child, for the
not
because
blindness,
they gone
but
to fetus,
yes, but not blindness, but maybe in the severe case like abnormal in neurology. Okay, neurology called brain abnormally, liver abnormally. Yes, something like that.
In your case, in your experience, what worst case that you have ever met?
Stillbirth, it means that labor and then baby death in front of you immediately.
After delivery.
Yeah, after delivery. That is the worst case. Yes, because stillbirth.
But I'm as a layman. To talk about this matter, I think better pass away than
Yeah. That's right.
the
Yeah, if they have defect
the baby-
and have go on
the
with
baby
defect.
lucky enough to go back and rather than to face such a
Yeah. That's,
difficult life.
yes.
Well, so how to treat syphilis if being confirmed of infection, particularly during pregnancy again? Yeah? There's more concern about pregnancy. So, like we're talking about that only by antibiotic.
Yeah, it means that it's the best way to check and have antibiotic before labor. That is the best way to prevent to pass this disease to the baby.
You're giving the paper like this, we can easily because anybody who have such kind of feeling that the tongue has some ulcer or something, they themselves should know something, right? Normally they ignore it.
Some patient told me that they do not notice that any ulcer in their tongues.
That's it.
Yeah, when
But
we
they don't feel it when
examine-
they eat. No pain.
Yeah, because there is no
painless.
painless.
Oh, it's painless, even if it's
Yeah.
small there.
Yeah, it's
It's
painless.
very strange.
So maybe
strange.
even patients notice about that and maybe wait and see maybe and
Weight
then it's
loss?
gone.
Do they
No weight loss.
Eat
They
well,
are
sleep
healthy.
well.
They are
They're
healthy. Yes.
This is very strange.
Yeah.
Actually, where is originated syphilis?
Where is originated? Do you mean in the
Yeah,
world?
yeah.
it's
They say
quite
from
long
ancient
time.
time,
Yeah,
from the Egyptian time.
Yeah, this is come from ancient time. Yeah, we can see in
And then gradually decrease because of the better medication. That's right.
because after we found penicillin.
Penicillin.
Yes,
Uh-huh.
after we found penicillin, and then we can get rid those diseases. I heard that in the War II, soldier in have also have been infected with syphilis. Yeah, in War II.
World War II, yeah. So among themselves, very scary. So what are the preventive measures to decrease the risk of syphilis? Preventive measures, wearing condom,
Yes, wearing condom have less
Refusal.
partner.
ah,
It will be good if have only one partner. Yes.
one wife,
Yeah.
one partner.
Yeah, one life, one partner. Yeah, and if they have partner, and it will be better to have to using condom if they do not ready to have baby. Yeah, because condom can prevent sexually transmitted disease and also get pregnant. Yeah.
Doctor, to what stage that nothing can be cured?
Nothing can be the thing that can be cured is in tertiary syphilis. That
Surgery?
yeah, we call tertiary syphilis.
What's
After
that?
it means that after patient get syphilis for many years, maybe 10 years, then and have not been treated, and then it can be occur in skin also again. But this also is different from primary stage and secondary stage. This also can cause scar.
Scars.
Yes, can cause scar. And in this stage, syphilis can go to brain and can go to heart. Yeah, and can make brain abnormally. It can cause abnormal movement and also uh, can cause Alzheimer too.
Even a younger age?
Yes, younger age that come with confusion. I mean that have like blur or yeah cannot recognize anything. Yeah, we have to check for syphilis.
That is the
Let's
more
go to
seriousness.
yes.
That's more serious. Do we have that in our country?
Yes,
We do have.
we have neurosyphilis. Yes.
So sad. So how does the Department of Disease Control plan to deal with the rising number of the syphilis cases?
Yes, after then condom promotion, we also try to implement STI services. Yes, to every hospital in government hospital, to like the way that patient can go and like to do sexual health checkup easily, because we know that it's quite difficult to for the people who have unprotected sex to go to the counter and tell that I want to check
Yes,
something
that's
like
the
that.
Thai mentality also.
Yes,
I think they're too shy to.
Yeah, maybe
to
they
do so,
shy.
yeah.
Yes. So one thing that we try to change the attitude, because maybe that the attitude that people that go to check, it mean people to have risk. We want to change the attitude. People to go to check, it means that people who
Caring
want
of
to
yourself.
be caring of themselves, want to have health, to be healthy, want to be healthy, right? Because and then they go to check. So we try to say that if anyone have unprotected sex and should go to check, we try to avoid to say that if you go and have risky behavior and then you go to check, it's different. The feeling is different. Unprotected sex can occur with anyone, but when they say risky behavior, someone say, oh, it means that you go and buy for sex, something that like that. So if we try to change the attitude that anyone that have unprotected sex, like when we eat too much and then we go to check cholesterol, something like that. And if anyone have unprotected sex and they go to check for sexual health checkup, yeah, just that. So we try to bring those service to integrate this service to government hospital normally, yeah, in general. So people can go and ask for checkup easily. So we try to implement those service. Yeah.
Is there any shake-up or stopping of the some what do you call career that promoting this, like prostitutes or something? Do we have a what do you call a mobile team to
We call
check
outreach
them?
program.
Outreach, you call
Yes, we call outreach program.
Very good.
Yes, to check and test and treat. Yeah, in one day. Yes. Before that, because of the treatment need to go to the hospital because they need to get shot. Yeah, for treatment that maybe it's hard for people from mobile area that we go. So maybe in Department of Disease Control we will bring the new treatment. Yes, come.
Yeah. Okay, my last is your advice to the teenagers over here, please. That how to avoid being contracted with syphilis.
Yeah, the best way is to do blood check regularly and using condom. This is the best way for avoiding syphilis. Syphilis can be treated if you go and have blood check.
I really wish you all the best, Doctor, for this
Thank you.
heavy work, and we entrusted you with reducing in number.
Yes.
We're ending up with great thanks to Dr. Rossaporn Kittiyaowamarn. She's the head of the Sexually Transmitted Infections Cluster, Bangrak Hospital, Departments of Disease Control, under the Ministry of Public Health. So thank you for being here, and looking forward to see you again.
สวัสดีค่ะ
We're ending up our program with thanks, and hope you enjoy the show and making use of what we're talking about today, and looking forward to see you again. สวัสดีค่ะ